The White House is trying to show that most Americans can get COVID and recover without too much suffering and disruption if they've gotten their shots and tried to protect themselves. One major question that remains unanswered: where did the president contract COVID-19? He's had a busy travel itinerary as of late, including trips to Rhode Island, Massachusetts, and overseas to Israel and Saudi Arabia. When pressed on where the president contracted the virus, the White House said, quote, "That doesn't matter."
Where was he infected? I don't think we know. I certainly don't know if you have any thoughts on that.
Look, I don't think that matters, right? I think what matters is we prepared for this moment.
Thursday's White House press briefing was dominated by questions on the president's health after he contracted the virus.
Hey folks, guess you heard this morning I tested positive for COVID.
Officials say he's experiencing fatigue, a runny nose, and a dry cough, but say his chance for serious infection are dramatically reduced as the president is fully vaccinated and twice boosted. Mr. Biden was given an antiviral medication, Paxlovid, and he's expected to be isolated for at least 5 days while he works from the White House.
Our expectation is that he's going to continue to have mild illness, and he's going to be monitored for symptoms.
Doctors say a major factor in the 79-year-old president's treatment is his age, and he will be closely watched. The White House has reduced the residence staff to essential personnel only and plans to contact trace anyone the president has been in close touch with. Brody Carter, CBN News.
Well, for more on this story, our CBN News medical reporter, Lori Johnson, is with us. So the president is in a high-risk category because of his age. How concerned should we be, or should his doctors be, about his condition?
Well, you know, his age is a very major concern. Age is the #1 risk factor by far, and he's going to be 80 in November. You know, Gordon, out of all the people who have died from COVID, 81% have been over the age of 65. And of course, he's well over that age. But yeah, doctors really aren't that concerned about him. They say that he'll probably just continue to have these mild symptoms because he's fully vaccinated, twice boosted, and although the vaccines don't prevent us from getting sick, they're very effective at keeping us out of the hospital. He's on the Paxlovid, that's good. But really one of the major issues is that he has Omicron. And this Omicron variant that's been with us since January is a lot less severe than the other variants we saw, like Delta, because it tends to stay in the head or in the neck. So people have symptoms like the president had, where you have a runny nose or headache, congestion, sore throat, but not that difficulty breathing, which is what we saw so often with other variants like Delta. So that's why so many people are in pretty good shape, like the president, is there are so many things that mitigate this virus. But I should point out, Gordon, that we're still seeing more than 400 people every single day in America die from COVID. That's still far too many, but compare that to the worst of this pandemic back in January of 2021, where 3,300 people were dying every day.
Okay, well, tell us about the medicine that our president is taking. I believe it's called Paxlovid. It's an antiviral. How effective is it, and will that reduce his symptoms and lead to a quicker recovery?
Well, Paxlovid is the best way to think about Paxlovid is to think about Tamiflu. So folks who are familiar with Tamiflu, Tamiflu is to the flu what Paxlovid is to COVID-19. As you said, it's an antiviral. What that means is it stops the virus from replicating. When you're infected with a virus, it starts to multiply. So it's very effective. It's 90% effective at keeping unvaccinated, high-risk people out of the hospital. That's what the study showed. And the key, though, to Paxlovid, like Tamiflu, is that you want to start taking it early. Ideally, you want to start taking it 24 to 48 hours after the onset of symptoms. So, Gordon, I know you are a he-man. You're kind of a macho man. So when you start having symptoms, you ignore them until you can't function. So don't do that, because the idea with antivirals like Paxlovid and also Tamiflu is you want to take them as soon as you start noticing those symptoms.
All right. Well, I'll ignore the he-man. Let's get back to the vaccine. Under the new variant, it doesn't seem to be effective to actually stopping you from getting it. So should we still be looking at getting boosters? And is there going to be a new booster for the Omicron variant?
Yes and yes. So doctors say if you are over 50 years old and you haven't gotten your booster this calendar year in 2022, you need to get it. You need to get it right now because vaccines have been shown to be very effective at preventing severe disease and death. And also not only people who are 50 and older, but under 50 who have medical issues like they may be immune compromised. Now, the new Omicron-specific vaccines are going to be introduced to the public in October or November. So these ones have been targeted specifically for the Omicron variant and the various subvariants that we've seen since January. Those will be out this fall.